To make sure the vaccine gets into as many arms as possible is hitting an unexpected obstacle. Believe it or not, some healthcare workers are declining the shots. News 2's Mai Owens says doctors are now working to combat fear from their own colleagues. She begins tonight's vaccine tracker team coverage.
They've been on the front lines of the pandemic, often urging the public to get vaccinated. But not all healthcare workers are heeding their own advice.
We need to have all of the people who are sharing the airspace with us immunized as much as we possibly can. And so that's why it concerns me when I hear that 30% of our employees have not even signed up yet.
Dr. Walter Clare is talking about a recent report stating nearly 30% of Vanderbilt medical staff chose not to get the vaccine. Those staff members range from physicians to employees who don't have direct contact with patients.
It was discouraging, particularly because a number of my colleagues, professional colleagues, physicians and nurses, as well as non-direct healthcare providers, agreed to participate in the studies.
The study showed a majority of those saying no are African American or Hispanic. The reason? Distrust among minority groups that have been disproportionately affected by both the virus and its economic fallout.
I think part of the reason is because, of course, there was this sense among people that there was a rush to get it made. The Moderna study and the Pfizer study specifically went out to recruit a significant number of people of color to be in those vaccine trials.
It's more than a simple yes or no. The decision is complicated, and convincing someone to get vaccinated can be just as difficult.
In this country now have 500,000 examples of why we should protect ourselves from this virus.
Doctors hope their fellow staff members will properly assess the risk and benefits of taking the vaccine, providing a united message to others. In Nashville, Mai Owens, News 2.